Hello everyone, this is Dr. Rana Mondal. Today we will discuss about TI and OI, Timed Intercourse and Ovulation Induction. This is a simple yet effective approach to get pregnant. If you are trying to get conceived, this video will guide you and teach you and explain you about how time intercourse and ovulation induction is a helpful and very simple effective method to give you desired pregnancy. Time intercourse means having unprotected sexual intercourse during your fertile window, that is 2 days before the ovulation, one on the day of your ovulation and 2 days after the ovulation. That is the period of your menstrual cycle when you have highest chance to get conceived. Now, how do you know you are ovulating at that moment? There are few ways you can get to know that you are ovulating. One is using ovulation strips. From around day 8 or day 9, every alternate day, you need to check the strip from your urine sample to know when you are ovulating. If you see your ovulating results are positive, you should have intercourse that period. Other signs you to know about ovulating is that increase your basal body temperature rate, or sometimes there is increased cervical mucus thickness that will give you sign of having ovulating. Another way medical approach to know you're ovulating or not is by doing folliculometry. That is, you go to the clinic and you will be undergo ultrasound where we will check your eggs are developing and when your eggs are rupturing or not. When your eggs are rupturing is the time your eggs has been released, and there is a chance when you can get conceived. Ovulation induction involves stimulating your ovary to release the eggs by using some form of medication, either oral or injectable, to release your eggs and making it a more predictable that your eggs will be released in a certain time of your menstrual period, and it will make sure that it increases the chances to get conceived. Ovulation induction mostly used drugs are the letrozole or clomiphene citrate. Sometimes for obese women, we may need to use some types of drugs known as gonadotropins, which are usually an injectable drugs. Ovulation induction is mostly beneficial for the women having irregular periods, unexplained infertility, and women having polycystic ovarian syndrome. OI makes sure that you are releasing your eggs in a certain time, and TI, time intercourse, makes sure that when your eggs are being released, you are having an unprotected sexual intercourse during the fertile period so that you have a highest chance to get conceived. We usually do a folliculometric test, that is, we will assess from your day 9, day 11 or day 13 onwards to see your eggs are growing or not and when your eggs are rupturing or not, that is, your eggs are being released from the ovary or not, and when your eggs are released we will be informing you regarding that, and that will give you the idea when to have time intercourse. Another important thing that sometimes some women have some syndrome where the eggs are not released, so we can identify luteinized unruptured follicular syndrome also. Women having irregular periods, women who are obese, having polycystic ovarian diseases, or if the couples having to stay away from each other, or sometimes with mild male factor abnormalities. Remember, OI and TIs are helpful in certain conditions only. If you are suffering from severe cases of infertility, this won't be helpful for you guys. Usually there isn't any type of side effects of having this procedure because it is only assisted procedure and otherwise it is a natural conception. Still, as we are inducing your egg here, so there is a high chance of having multiple pregnancies, and sometimes your ovaries can get hyperstimulated also. Sometimes there can be side effects due to using these drugs also. Please contact your fertility doctor if you are experiencing any of the side effects of the ovulation inducing agents. OI and TI are often simple and straightforward approach for many couples who are trying to get conceived, as they optimizes the chances of getting pregnancy by having time intercourse on your fertile window. OI and TI, if you think it's helpful for you guys, please consult your doctor. Thank you.